size the graft using the slotted sizing block. The tibial tunnel is created using standard techniques and can be done before or after the femoral tunnel is created. The preferred VersiTomic AM guide is placed through the anteromedial portal and positioned in the desired location. The AccuPin is engaged to identify the plane in which the pin should exit. The VersiTomic SMA flexible pin is then advanced through the AM guide and advanced to the lateral wall of the intercondylar notch. Note, recheck positioning of the guide to ensure placement has not been moved during introduction of the guide pin. The guide pin is then advanced in small increments until it exits out of the femur. Note, advancing the pin driver close to the guide helps prevent the flexible guide pin from wobbling during drilling and helps ensure solid advancement of the pin through the femur. Advance the pin until the line where color and finish changes from shiny to matte is flush to the intercondylar notch. Make a small nick at the lateral exit point of the pin and slide the outside in-depth gauge over the pin until it meets the bone of the femur. Depth gauge reading is referenced from the very tip of the guide pin. After measurements have been taken, check the amount of flexible pin exiting the anteromedial portal to ensure the entire puzzle piece portion will be supported by the flexible pin. To ream the femoral tunnel through the anteromedial portal, reference the markings of the exocentric head. Insert the VersiTomic reamer over the guide pin with a single cutting flute away from the medial femoral condyle and PCL. Drill the femoral socket to the desired depth based on depth gauge measurement. After the desired tunnel length is reached, run at full speed up and down the pin for debris removal. To utilize the ProCinch adjustable suspensory fixation, the tunnel must be reamed through the distal cortex with a 4.5 mm VersiTomic flexible reamer. Do not use excessive force with the small shafted reamers, 4.5 to 6.5 mm. Wait for the reamer to do the work. Once tunnel creation is complete, use the suture eyelet to pass suture through the femoral tunnel. Select either the ST or RT ProCinch configuration. Insert the speed shuttle tail from ProCinch in the loop and pass the suture. While pulling the implant through the tunnel, ensure the button is facing anterior. Once the lead and flip sutures are through the skin, unthread the speed shuttle by holding it right at the splices. Pull in line with the graft tunnels until the button exits the cortex. Pull using the green lead suture while maintaining enough tension on the green and white suture to keep out slack. Use the flip suture to deploy button on the cortex. Use the flip suture in combination with the lead suture to ensure the button is fully flipped. Pull down on the graft to ensure button fixation is adequate. If using the ProCinch RT, incrementally tension the adjustable loop by pulling on the tensioning tails. Alternate pulling the tensioning tails to adjust the loops a few millimeters at a time. Continue tensioning until desired length is achieved. Note, maintain tension on the graft to prevent pulling the button into soft tissue. If using the ProCinch ST, incrementally tension the adjustable loops by pulling the tensioning tails. Alternate pulling the tensioning tails to adjust the loops a few millimeters at a time. Continue tensioning until desired length is achieved. Ensure suture loops and tails of the tensioning sutures are equal with either configuration. Fixate the remaining portion of the graft using a biosteone interference screw.